Hi, everyone. We're gonna give you all another minute or so, some time, give everyone some time to get in. As you arrive, please enter in the chat your name, your location, and where or with whom you're affiliated, whether it's an organization, if you're a community member, if you're the FBI, whatever affiliation you have, please just go on and enter that in the chat. Oh, Dr. Angela. Hey, Dr. Angela.
Yay! Hey, Dr. Angela.
Panelist from webinar 2, personalized obesity care for women.
And
yes, Overcoming Obesity Club.
I give her all her credits, all of them. Yes.
But then we have a lot to talk about.
That is true. That is true. We'll give her at least those two, though. I don't want to shortchange her. Oh, thank you. I appreciate everyone saying hi in the chat.
Yes. Hi.
Ah,
now I can see it. Hi, everyone.
I have my family joining from Arkansas. I love it. Thank you.
Wonderful.
Cousin Mary is in the building. Yes. Aww. Thank you, Dr. Angela.
And feel free to share. This is the final installment of the obesity webinar series that Dr. Sylvia has worked so hard on, and the panelists that she's invited. So please, please extend this the invitation to whomever you think this will be useful for. And honestly, everyone, because if it doesn't directly apply to you, certainly people who could benefit from this information. And we can dispel some myths while we're here. Okay. All righty. So in the interest of time, we're going to go ahead and get started. I am Tashi Jacobs. I am the FBO program coordinator at Black Health. And what is Black Health? Black Health is an organization that has existed since 1987, when we were initially known as the National Black Leadership Commission on AIDS. And now we are, since 2019, the National Black Leadership Commission on Health. And we just broadened our horizons to discuss a lot of other health disparities that affect people who look like us, Black and brown people. So now we focus on not just HIV/AIDS, but also hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, mental health, which is a big component. So we have expanded, and right now we are going to talk about obesity. And what we've learned so far is, well, we've learned a plethora of things, but one of the biggest takeaways is that we understand now, as of recent years, obesity is a disease. And so we've had to readjust how we think about obesity, the biases associated with it, understanding who's affected, and we all could be at risk. And just, having a better idea of what it is, how to approach it, and how to be there for people who are suffering with this disease. We know that it's more than physical. We know that it's bigger than your relationship with food. We know it's mental. We know it has a lot to do with your environment, your upbringing, all of those things. I am not a doctor, but I am going to let
You're on a roll though, so go ahead.
Good, right?
I am going to invite Dr. Sylvia to take over to tell you a little bit more about who she is, what she has going on. She'll share a little bit about her story, and then she'll also introduce the lovely panelists that we have for you this evening. So, Dr. Sylvia.
Thank you so much, Tashi. Tashi, actually, it was like music to my ears and to my heart, because it just shows like how much even you have learned through this webinar series and through the work that we have been doing. And so I was like, that's a perfect summary, right? Without all the like getting into all the little minutia and medical terms and all the stuff we use. But I mean, that is the biggest takeaway that we wanted everyone to feel empowered with that education about from this series, is that it's not your fault. It is not your fault. Yes, there may be some controllable lifestyle changes you can make, but there's a complicated disease, inflammatory, neuroendocrine, like all the words, insulin pathway that is going on in there, in your body, that is driving your body to store excess fat. So we wanted to just make sure that, especially for we as Black people and who are disproportionately affected by the disease of obesity because of many, many factors, right? All the things that we're going to talk about today, that we have the knowledge that we need, because knowledge is power, so that we can make those meaningful lifestyle changes, but that we can control what we can. There's some things, as we'll talk about today, we can't control. That's not under our power, but we're going to work as organizations and as systems to try to change the system. But what we can change as individuals, we want to make sure you have that information. So thank you, Tashi, for saying that. And then Tashi always gets on me because I never talk about myself a lot. Actually, Tashi and Dr. L. But for those people who do not know me, I am Dr. Sylvia Bollie. I am a dual board certified. Well, first of all, I like to say I'm a child of God, okay? Because that's from which everything I do flows, and that's why I do what I do and why I'm so passionate about the work that I do. So I'm a child of God who's been blessed with a lot of knowledge. I'm an integrative obesity specialist. That means I practice holistically, body, mind, and spirit. Yes, I'll use meds if I need to, but I really try to get to the root cause of what is driving that. And a lot of it is mental, and there can be spiritual triggers as well. So I help people figure out what's causing them to store extra weight and extra fat. And then as a wellness consultant on your health, I partner with you to come up with those strategies for consistency. And I'm a best-selling author and a content creator. Hence why I'm here and been working with Black Health for over a year now to help them come out with high quality obesity content that really makes an impact. So I'm honored to be here today with my dear friends. I can honestly say that when they were like, okay, you need to do this and you need to pick fabulous doctors, we don't want boring stuff, I said, okay, well, no worries. I know fabulous doctors who are highly intelligent, beautiful, and they can bring it with the information they're presenting. And so that's why I called on Dr. Tiffani-Bell-Washington, and then my dear friend and colleague, Dr. Latosha Flowers. So we have put together a phenomenal presentation for you today. And I'm going to have them introduce themselves in the order that they appear. Is that okay, ladies? Yeah, because I want them to share, like, we all have personal connections to obesity. If you've watched the past few, you've seen my story. My background is my grandma Sylvia died from complications of obesity. And then I personally had to overcome obesity on my own journey after I gained 60 pounds during my postpartum after I had my baby. So that's how I became really passionate about this. And I saw that it was more than just weight, more than the physical weight. All right, so without further ado, in the interest of time, because we have a lot of wonderful information to share with you, we'll get our presentation started, and I'll have these presenters introduce themselves as we go through. So today's topic is people are not obese. People have obesity as a disease. And we all have no disclosures to represent. Also, just to let you know, this is, while we are doctors, we are not your doctor. This is for educational and informational purposes only, but that doesn't mean that you can't apply some of the information. And also this, it doesn't represent any other entity other than ourselves that we're representing. Again, this is the last of a 4-part series. It has been wonderful. So I hope that you had a chance to watch the previous ones, we'll be making some references to them. If you didn't get a chance, go back and watch it. The first series was with Dr. Joynita Nicholson and Dr. Daphne Bryant, and we covered just the very fundamentals. Obesity is a medical disease. So much good information in there, talking about how BMI is a lie, how we can use it better in our population, just a lot of great baseline information for you. Then the women, Dr. Angela Clack, who is also in the audience today, and Dr. Carol Penn, we went through talking about how to personalize your journey for you for women. And then the men, on August 30th, we talked about, for men, how to personalize this care. And it was really a rich conversation. So please, if you know a man who's struggling in that area, but too prideful to come, like, slip this to him, just slip it in. That's what I do with my husband. I just kind of slip it in. Let me text this to you quietly so we can see. So without further ado, today we're going to be talking about obesity. Is a complex. At the end of this presentation, we want you to know that obesity is a complex medical disease and not a lifestyle choice, that words matter. So people aren't obese, and we'll say why we say that. The difference between fat phobia, we see a lot in the media about fat phobia, and the difference between that and weight bias. And then also just like the intersection of all the different forms of bias, racial bias, gender bias, sexuality bias, and weight bias all together, and how that impacts, how that weighs on us as Black people, and how that weighs on our LGBTQ plus community as well. And then also how to protect yourself. So we're not going to leave you down in the dumps just with a whole bunch of facts, but knowledge is power. So what can you do? And so, Dr. L and Dr. Tiffany, like, they put together so much stuff. It was so hard to decide what to share. So there's some really great tips there. So what you can do as an individual, but also what are the systematic changes that need to be made. And so Black Health will share some of the obesity policy work that they're doing. So with that being said, I want to just start with us relaxing, because one of the major triggers for weight, and that we don't talk about, people always talk about the calories in, calories out, but high stress levels is one of them. So one of the things that I like to do in my practice, we start every session with a peaceful moment, and we do a release and an embrace. So right now, I want you to just be aware of what emotions are you feeling? Top 3 emotions, jot those down. If you want to put it in the chat, you can put it in the chat, but what's the top 3 emotions that you're feeling right now? Now look in the chat if anyone is. Oh, thank you. Look, I see all this love. Dr. Bollie's book is such a great read. Please feel free to take notes. Yes. So excited, tired, and grateful. Love all of that. Yes. So what we do in the embrace and release is that excitement. I love it. Dr. Kina, hey, another one of our overcoming obesity panelists as well. So let's just take a few minutes and just breathe. So feel free to close your eyes if you want to, or leave them open. I'll leave them open, of course, so I can see it. And I'm going to go ahead and I'll set a timer because I don't want to overdo this, and I could relax a minute. So hey, Siri, set a timer for 2 minutes. All right. 2 minutes. All right, so I want you to sit square, put your body straight and square on the seat in a comfortable position. If your feet can touch the floor, make sure they're firm on the surface that you're in. And I want you to take a deep breath in through the center of your body. And to the count of 3, we're going to release. Releasing overwhelm, releasing upset, and releasing tired. Now, welcome the breath back in your body. This time, take a deep breath in, all the way through the center of your body, down through your thighs, through your knees, to the soles of your feet where they hit the ground. And we're going to exhale to the count of 5. And this time, we're embracing energy, embracing excitement, embracing gratitude, embracing empowerment, embracing peace. Now, one more deep breath all the way through the center of our body, down through our legs, down to where the feet hit the ground as deep as you can. Feel the air filling your lungs, and let us exhale to the count of 7 this time. And now we're going to embrace peace, embrace joy, embrace love, embrace community, embrace control, embrace progress, embrace you. All right, slowly open your eyes if they were closed. And I hope that helped you feel a little bit more relaxed. And this is something that you can take throughout your day. I usually recommend for people, whatever emotion you're feeling, that negative emotion. I love Elizabeth. Thank you for your honesty. So notice I started there. She said overwhelmed, upset, tired. So what's that emotion that you want to release? And what is the emotion that you would like to replace it with or embrace it with? And coupling it with that deep breath really helps, because that's going to activate your body's natural stress relief system, or the parasympathetic system. So that's a small practice that you can take with you throughout your day for the stress relief. And you're very welcome, Elizabeth. I'm glad it helped. All righty, people. So now we're ready to learn. We got our minds clear. Woo, okay, yes, here she is, the one and only Dr. Latosha Flowers, who goes by the motto, each one, teach one. And she is a best-selling author. She is a concierge, world-renowned concierge physician of over 20 years experience. And she is just a wonderful, loving person and a mom of an amazing son. And so I will actually let her tell her story, her journey of how she got here and why she's passionate about this topic. And she's going to be sharing a little bit more with us.
Thank you so much, Dr. Sylvia. First, I'm so happy to be here, because anytime I have an opportunity to just stretch my reach and far and wide, I'm always excited about that. So this topic is so important. I have my own journey, of course, with losing weight. Sometimes it came back, lose it again, and it came back. And I'm a scientist, so you would think the scientist knows what to do. Sometimes we do, sometimes we don't, but we still help other people along the way. And being transparent with our own journeys is why so many people do relate to us when we are. So I'm happy to always share my story in any facet. I'm a survivor of so many things, but obesity is one of those. And being obese as a child growing up, of course, dealing with all the things, bullying, being called fat, having low self-esteem at times. Most of the time I was able to overcome it. Thank God, because I had a great supportive system, but there's still something that you have to go through sometimes. And so that's why I have such a heart for anyone who is going through any journey. And in this case, we're talking about obesity and overcoming it. So that's why I love that that's Dr. Sylvia and I's show on Clubhouse, is overcoming obesity. We don't just say obesity, we're overcoming it, so that we always have an action plan. But again, I am Dr. L. Flowers is what I commonly go by. I'll let y'all know what my good government name is here, but I'm normally called Dr. L. Flowers, MD. You can follow me on all social media at that name. And with that, of course, Dr. Sylvia told you, I have over 20 years of experience as a family medicine physician, also telemedicine concierge. I've been a military physician, so I've traveled far and wide as well. And my moniker is each one, teach one, has been for such a long time. And that's why anything that I have to add to you, to your life today, I'm happy to do so. And that was my prayer before we started. Lord, give me the words so that someone in this audience is touched, and something that we say collectively helps them along their way. So thank you, Dr. Sylvia, for allowing me to introduce myself. And I am complete.
That Clubhouse exit. So great. Well, thank you so much, Dr. L. And thank you again for your honesty and sharing your journey, because yes, weight bias does affect our mental health, and Dr. Tiffany is going to be talking about that too. Now, so we're starting off by how weight bias can interact with health. And so Dr. L had this really moving case. We also wanted to highlight throughout this series, so we've mostly been talking about adult care. So we wanted to talk a little bit about childhood obesity. And so Dr. L's going to use this case or this story, so to speak, to tell you about how she saw a case of weight bias, childhood obesity interacting. And so I called it big bone bias because I'm from the South. I'm from Atlanta. People are big boned. We don't say obesity. Yeah. So let's talk about, Dr. L, please take it away and share the story.
Yes, so this case was very touching for me because it's one that I'm continuously remembering, telling, and constantly learning from. But as a family medicine physician, I have the pleasure of taking care of all age groups. And part of that is doing pediatric care. And so on this particular day, I had a patient come in 3 years old, and he was accompanied by his mom and a cousin, same age. And they're just for his well child check visit. And with that, the graphs of his weight and height, all that stuff was done before I walked into the room, and then my staff brings it to me. I already was like, this is different, because this young child who was 3 years old was at the weight that you would expect of a 12-year-old child. So he was off the charts. And Dr. Sylvia, I know that you will provide a weight chart for us so that people can understand that better. But that was pretty amazing just off the bat. Like, what is going on is some of the things going through my mind before I even walked through the door. Then when I did go into the room to introduce myself, I'm always so happy to make sure I know everyone in the room. And Mom was already a little hesitant because I don't know, she probably felt embarrassed about some things. And later she shared with me some of the reasons why she was hesitant to talk to me. But the other thing that I noticed looking at the patient that I was there to see, he had Cheeto cheese on his fingers and on his face. And so I was like, oh, is it still lunchtime for him? She said, well, no, he just had a snack. And she picked up a big old family-sized bag of Cheetos. And I was like, that's his snack? She's like, yeah, he just finished the bag. And I was just looking like, okay. So we have a lot to talk about. But also on his exam, Dr. Sylvia's provided the graph that I'm talking about for the weight. So if you can look, I know it's kind of small and hard to read, but that second line on the very bottom, that's age 3 years old. And so he was very much at the top of that pink zone for his weight. And so with that, that's alarming because again, he's a child, he's 3 years old, he should be running around playing. But what I saw in front of me was a young child that actually had problems with movement because he was so heavy. And even when he just did minimal movement, walking across the exam room, which wasn't that big, climbing onto the exam table, which he should be able to do easily at 3 years old, he struggled because he couldn't balance his weight. He also was out of breath. And so those were two things that I just have to make observations on because he was struggling. And then during his exam, I also noticed on his skin that he had some discoloring around his neck, acanthus nigrans. And with that, that's usually a sign that someone has had high blood sugars. It doesn't always mean definitely that they have diabetes, but at some point they've had a sustained high blood sugar. And so just me paying attention to even small details like that was very important for the conversation that me and Mom need to have just on his regular well child check visit. And so I was very happy that we were able to talk about that. Do you want me to go further, Dr. Sylvia? You want me to stop there for a moment?
I think that's good. I think one of the key things that you brought up, and I hear a lot in lay public, like if someone sees someone's neck darker or acanthosis nigrans can also go under the underarm and in other skin folds, they're like, oh, they just need to wash better. I've literally heard this, right? That's a common myth. So I think it's important that the audience recognize that this is actually part of a medical sign of what's going on internally with those high sugars, like you said, with high insulin resistance. So thank you for pointing that out about this case.
Yes. And then the other thing I do want to say, again, he was accompanied by Mom. This young man also had a mixed heritage. He was mixed with Samoan and African-American. And with his younger, or with his cousin who also came, she was the exact same age. I think they were about a week apart. And it was really interesting to see them too, where she was in a normal weight range for a 3-year-old. And she was running circles around him in the room and they were playing, but she was playing keep away and he couldn't catch her. So that was important to notice as well, part of his movement disability, because he was so heavy. So what do we do next? Well, I love that Dr. Sylvia called this the big bone bias, because it is true, not just in the South, but I would say, because I was raised in California, we love saying this in the Black community, big bonedness. What is that? That is not a medical term. I just want to we're quick in our community to make up some stuff, but that's interesting, because he had been teased by his cousin. Mom was embarrassed by him. And then when I delved into more about their family structure, mom also had the Samoan grandmother and the African-American grandmother in her ear telling her that she's being too hard on him when she was denying him processed food snacks and trying to get him to eat more fruit and vegetables. And so there was a lot going on that all contribute to this one child being as obese as he was. But there was more to the story, and I don't want to give away everything in this one moment. So yes, thank you, Dr. Sylvia. Medical causes, so many. But I love this slide too, because we talk about it's not your fault. And please, if you don't take anything else away from our talk today, please take that with you. It's not about willpower. Sometimes there's so many things going on. Depression can lead to it. Again, I just talked about heritage and your community. In this case, I was dealing with the Samoan heritage, the African-American heritage and community, family traditions, also influences from two grandmothers. That's a lot to deal with one, but two grandmothers that spoiled the child and rewarded him with candy, ice cream, whatever he wanted, he could have. There was no limits for him. And it was because he was the male child. So that was interesting to also play a cause into what was going on with him. And in this case, with him being so heavy, he was being ostracized by his own cousin. So that's in the family as well. Also playing with other kids when he did go to the daycare, he couldn't keep up with them. So you can only imagine how kids were relating to him, talking about him, and in that case, making him feel bad. And so messing with his own self-esteem in that light. And then two, mom just not having a sense of what to feed her child, or in this case, feeling lack of control over her own child. She felt hopeless in this case because of the two grandmothers in her ear. So it was a lot to pick apart, but I was so happy that I had the time and was happy to talk with mom, just so that I could, one, sympathize and empathize with her, and then come to her from mother to mother, because my son was a little older than this child that I was seeing, but still being a mom and understanding that struggle when you have grandparents in your ear, but also wanting to make sure your child eats a healthy meal or has healthy snacks, that can be a lot. So that's one thing. Dr. Sylvia, you want to give us any more comments on the slide that you just have up for us?
Oh, no, I think you hit on it so well. And, this slide is one of my babies, right? But we're not going to go into it, but it's just to show you that this slide has 70 triggers for weight gain or abnormal fat storage, or obesogenic is what we call it, right? Obesogenic factors. So just to show you, and you hit on them so lovely, right? Like the genetics, the family environment, the eating behaviors, the stress of those environments. So many of those things. One of the key things though that I wanted you to highlight, and I know you'll talk about it later, is just even the bias in the healthcare community. And Dr. Tiffany's going to talk about that as well, because just because of this child's heritage in the midst of being big bone, like a proper medical evaluation had not been done with them.
Exactly. So again, I was doing his 3-year-old well child check, but he had been seen at 1 year old and 2 years old. And I asked mom about how did those visits go, especially the 2-year-old visit, since that was the most recent. And she was like, well, they said he was a little overweight, but no one said anything else about it. And I was like, did they advise you on how, snacks or foods and things like that? And she was just like, well, they gave me a pamphlet. And I laugh now, because I think I probably laughed then too, because when we are as providers and as clinicians, we have to understand humans are humans, and just acknowledging that there is a problem can sometimes be the window to the solution. But because the other providers didn't acknowledge that this was an obesity issue, Mom didn't think much of it, nor did this child get the help that he needed much sooner. So that's our fault as clinicians. I will definitely assume responsibility for that. But also too, just giving someone a pamphlet and say, oh, read this, without telling them the importance of the food pamphlet, why you're giving it to them, how it can be helpful. And then how about scheduling a follow-up visit? That's amazing. And that's what I want everyone here to take away, some sense of empowerment, that even if you are seen by a clinician who you think may not have done everything you need done, don't be afraid to get a second opinion. Also, it's okay to change doctors if that's possible within all the constraints that we're dealing with insurances, locations, and things like that. And then also, if someone does say, or if they give you a pamphlet for any one thing, then ask them, well, do I need a follow-up visit with you? Because if they're asking you to read something so that you'll change something, well, we should monitor that something, whatever it is, in this case, obesity. And this child probably should have been seen not only at the 2-year-old well child check, but at least at 6 months to recheck his weight. And then if there was still an issue, dive into other causes and not just rely on it just being because of his heritage, as well as the family structure. So that's one of the things I just want to make sure that everyone feels empowered to ask questions and also to ask for follow-up care. So then that way we don't leave you hanging if we didn't have enough forethought on our side to say that ahead of time.
Whew, yes, girl. I mean, doc, excuse me, but but you have to chat
both of those because
lighting up. Yes. So Maria Davis says, what about when people say you're gaining weight because you're over 60 years old? And we definitely talked a lot about that in the women's health section, because there are hormonal shifts that do lead your body to store more fat once you're postmenopausal. But at the same time, any weight is a symptom of something else going on. And so doing that further evaluation is so important. Nikita says, so grateful you're discussing family influence on obesity outside of biology. And the information really helps a lot of folks release the shame and guilt of not working hard enough or being lazy. And she loves your tips on patient advocacy. Jen shares here that she remembered at her daughter's 2-year-old well visit, she asked the pediatrician if I should put her on a diet. And I'm glad the pediatrician said, no, you never put a toddler on a diet. But I wish she would have given me some more. I wish she would have said, maybe you shouldn't give her so many French fries, cookies, etc. She has struggled with obesity her whole life. So true. And, you know, there's so many misconceptions, especially in our community. I remember my dad was like, oh, I had not taken my son to McDonald's. Well, I should not say, to that place with the golden arches. And he was like, how could you deprive my grandson of this? Let me take him right away. Like, because so there, to your point, Dr. L, about the family influence and that pressure. So I can only imagine what she was facing. But all right, this is why I keep telling Tashi and Black Health, we need a whole conference on this issue. I said that every webinar because we could really dive deep. But without further ado, let me introduce Dr. Tiffani-Bell-Washington. She is a quadruple threat. Y'all see all the alphabet soup behind there. This lady does not stop. Now, she is a fund of knowledge. She's so humble. That's why, look, she's blushing. Even as I did these slides, I was like, I need to put some more here to tell them how wonderful you are. And guys, she has done all of this with 4 kids. She just got her MPH from Harvard, her master's of public health from Harvard, with like all her kids, I think, are under the age of what, 5, 6? Yes, 6, under the age of 6. She has twins, y'all, that are toddlers, and she did this. So I just have so much respect, appreciation, and admiration for her, and I'm glad she's here. She is going to share with us what's the difference between weight bias and fat phobia. But first, she's going to go into her own story, her why. Thank you so much, Dr. Tiffani.
Thank you all. Hopefully y'all can hear me okay. You're right, I am blushing, unfortunately. I am so happy to be here. As was mentioned, I'm Dr. Tiffani-Bell-Washington, and I am quadruple board certified. So I love hearing you all speak about mental health and the importance of more than just what you're eating and how much you exercise, but how you feel inside and how that impacts the choices you make and the stress and the depression that leads to, sometimes, to be quite honest, medication, but I'll talk about that after I introduce myself. So I am a psychiatrist. I am a child and adolescent psychiatrist. I am board certified in obesity medicine and also board certified in lifestyle medicine. So all 4 of those. I did get my MPH just earlier this year, May 2022. So that's actually my family there at my graduation. So I have twin girls who are now, they're 3. I have a 1-year-old who will turn 2, and my girls all have birthdays in December. And then my big boy there, he was 5 and he just turned 6 last month. So I have thank you. Those are my babies. So I have a lot of things to do, and I'm really busy, but I love it all. It keeps me on my toes. I also am an advocate, and I do a lot of health policy, which was what I specialize in, health policy and leadership, for my MPH, because I wanted to make a difference, and in a large scale that we often can't do one-on-one. Although I love talking to my patients one-on-one, I love doing conferences, and I do a lot of those, and a lot of public speaking. But until we really change the laws, like why are there so many, I won't say the name of the restaurants, fast food restaurants in certain neighborhoods, and liquor stores, and juice sometimes is the only thing that kids can even get, when they're out. So they're going to drink the juice and not the water, because that's what they're used to. And so those are policy changes that really need to happen to make a difference. And then I think that's basically it. I'm also on the executive board for Black Psychiatrists of America. So if you do have mental health issues, we'll talk about that later, but please feel free to get help, and don't have bias against that either. So we all have a why. If you look at these pictures here, that's my father over to the left, and that's my mom and dad to the right. My mom might be on the conference, I'm not exactly sure. She might be listening in, but that's my mom and dad. And then you see my family, that's my husband and my children. And then these are just random grandparents I saw, but online. I actually do, I have pictures of my grandparents, but I didn't want it all to be about me. But the reason that I'm so passionate about obesity and really health is that as much as I love family, unfortunately, I've had several family members who have passed away at very early ages. And it's for probably lots of reasons, but often they were chronic illnesses that, with good health and with proper medical care, you can get treatment. But, my dad died 4 days before my 16th birthday. So I say to people, while other people were planning and getting ready for their sweet 16, I was planning my father's funeral and begging not to have it on my actual birthday so they could do it the day after my birthday. And he had weight issues, he had blood pressure issues. I knew he went to the doctor. I saw him maybe taking a blood pressure pill every once in a while, but as far as I was concerned, he was healthy and everything was fine. So it really was a shock to me, especially as a child, that he passed away despite what I thought was good healthcare. So that really affected me, and I always wanted to be a doctor. My mom's a nurse. She always encourages education. And I meant at that moment, I sort of determined that I was going to make a difference in other people and help them not have to lose so many loved ones. And so that is my why. Personally, obviously, if you're having children, frequently your weight's going to go up and down and up and down. And so that's something that I also, you got to work on yourself too. So that's something that I often work on as well. Be like a flower, survive the rain, but use it to grow. So this quote just basically means we cannot choose the struggles that we get in life, but we can use them to create something beautiful. And, I also believe in God, and I'm a Christian, and I feel that God leads me. And I think that we have to take the best of what we have and make something better with it. And so I just wanted to share this quote. Next slide. So I believe this is a question, and you guys can put the answer of what you think in the chat there. But what is obesity? Is it a common, serious, and costly disease? A complex disease that occurs when a person has excess body fat? Chronic, relapsing, multifactorial neurobehavioral disease. So that's a lot of big words, but just complex, or all of the above. So I see a few people wrote answers there.
Yeah, we got some star students, and it sounds like they've been listening because this is the exact slide that we've
Right.
used in all the presentations, and they all said D. So
Okay,
yay,
they
as my
got it.
psychology professor used to say, learning has occurred.
There
So
you go,
people have
right.
learned through this series.
That
Yes.
is awesome. And so, yes, I know you all talked about this quite a bit, but obesity obviously is very complicated. It's important that you don't blame yourself, especially when I'm working with people on their mental health and not so much only on the obesity part of it. I remind people that self-blame never helps anything, right? You can't do better if you're only thinking of the negative. What can I change? Why did I do this? This is my fault. Like, you're not going to get far. So I try to make sure we are limiting bias and stigma. But what is obesity? So you guys have heard about this the whole time. Very briefly, if your BMI is over 30, and we're using BMI at this time, then that's your height versus your weight. It's a ratio. It's just a screening tool. But if it's over 30, then we would say you have obesity. And I just want to make a plug really quickly that I try to be sure to say you have obesity and that you're not obese, because I don't say that a patient is cancer, right? I say they have cancer. I don't say that, they are diabetic. That was a term back in the day. We don't say that anymore. We say they have diabetes. And we are people first. We have things happen. We develop diseases or, whatever happens to us, but you're still a person first. And so I try my best not to have someone be called their illness, because you don't own it. It's not yours. You got it for a minute, and we're going to move on past it and try to get better. So that's that slide. Next slide, please. So fat phobia, and we have a lot of slides. We're not going to get through them all. I'm going to touch on these briefly, and then hopefully we can have a discussion at the end. But fat phobia, fear of being fat, this is something that I encounter all of the time. I encounter it at work, in society. Of course, there's a lot of issue with blame and moral failing, implicit and explicit bias. So that basically means other people might judge me because of my weight, but also if I'm judging myself because of my weight, that's going to limit the things that I can do to get better, right? So some people won't go to the gym because they feel that others are judging them. Maybe they are, but they don't know. They're not going to get there to find that out. And so we'll talk a little bit more about the biases in the next slide. But we talked about norms of being big boned, and some people say, well, I look good at this size, so I don't really need to work on it. And for that, I just say, we likely can look good at any size because we are beautiful people, and we have nice shapes, and you can dress it up and make it look good. But if your doctor or someone is saying, hey, you have this health problem, I want you to try to work on your blood pressure, or your blood sugar is high, I just don't want anyone to feel like they have to say, well, I'm not going to do that because I look good. I want you to look good and live a long life. So that's just something there. But of course, anti-fatness is related to anti-Blackness. There are books about it. We can maybe put some of those in the chat. Racism, classism, misogyny, and lots of other reasons why people try very hard to stay away from being considered, quote, fat. And I actually have patients that will not take their medicine because they are very afraid of weight gain. And as a psychiatrist, we have medicine we put you on for depression, or we put you on for anxiety, or whatever it is. But if they're afraid that they're gaining weight, I have people who would get to the point of nearly being suicidal before they will consider taking a medicine because they do not want to gain weight. So next slide. All right, so weight bias and discrimination from others. Now, this is actually, see if you can find me in any of these. Okay, bottom, I'm actually clapping there. So I had the privilege, and I was really excited to be on the Red Table Talk. And I was there for this episode with Queen Latifah, where she actually talked about her work with Novo Nordisk, and how she is trying to change the thought about obesity, and realizing that it is bigger than just your weight, or bigger than what you're wearing, or your size. And it was a really awesome experience. But what I really wanted to show you all here is this quote. She said, "I've experienced being judged by others because of my weight. I know the negative effect it can have on you, but I never let that stop me, and neither should you." So if you did watch that episode, she talked very in detail about how she felt when living single, and all these times where she thought she was a good size and people were judging her, and she had to go on in public trying to battle her weight in front of others. And I mean, that's not easy for us, and we're going to work every day. It's not easy for someone in the TV and public eye as well. And so bias has a big impact. Bullying happens a lot when children are overweight or having trouble, self-bias. And so we have to take it seriously and realize that it's more than just the scale. So I wanted to add that. And next slide. Okay, so Lizzo, looking beautiful in this yellow onesie here. I don't know all the words, I'm thinking of kids' onesies. But, I always get asked questions about, oh, well, what do you think of Lizzo? Like I had one talk and someone said, well, is it good to be body positive? Because, like, what do you think of that? And my answer to that question is the same thing I said earlier, which is, I absolutely am all for body positivity. Why? Because I think that if you do not like yourself, you will not do things to improve your health. You're not going to you're going to just probably get more and more depressed and not eat and not choose healthy foods. So it is important to do things that reflect that you're feeling good. I was asked, if it's bad for people to feel good about themselves and be unhealthy, but my answer to that truly is, I don't have a clue how healthy or unhealthy Lizzo is by looking at her, right? People think they do because they say, oh, well, you're big, or she's skinny, so she must be healthy. But the truth is, a very thin person can have worse cholesterol, blood pressure, diabetes than somebody who looks overweight. But maybe their genetics are just different and they are not sick. So we cannot look at someone and judge them. And I think it's important to feel good about yourself. But as I said, if your doctor tells you to worry, then take that seriously and try to do something to help yourself. So here are a few sources of weight bias. It's everywhere. So healthcare, doctors, 69% of women experience weight bias. 31% of the nurses preferred not to work with someone who had obesity. That's quite unfortunate because a lot of our population has obesity. So, and then the patients don't want to get healthcare anyway from fear of being discriminated against, which is a realistic thing there. The workplace, media, social, like your environment that you're around, academics, and family. Next slide. So I'll talk about this, and I think we wrap up a little bit right after here. BMI, I mentioned it earlier. It is a big debate. A lot of people like BMI. They think it's something we should just hold on to it. A lot of people don't like BMI. And the truth is, I only use it as a screener. You have to also use common sense, because if someone comes in and they have a BMI that shows that they are in the, let's say, obesity range, but they work out every day, they have a body fat percentage of 8%, and they're very healthy with no other markers like high blood pressure or something. Obviously, I'm not going to say, hey, you really need to lose weight right away. You're overweight. You need to fix this. But on the other hand, if someone walks in, they weigh 120 pounds, their BMI might be normal. And if all their markers are saying that they need to worry, then I'm going to address the fact that no matter what the scale says, they need to be more concerned. So BMI is just something that I view as a alert, and then we can go from there with more evaluation. Next slide. So there's the question that's asked with Dr. Strings and Dr. Fatima Cody Stanford, and they have different answers, but kind of the same, right? So should we still use BMI? She says no, likely for the reasons mentioned. And then Dr. Cody Stanford says we should use it, but we should maybe modify it. And that's for the reason mentioned on the next slide here. Black women tend to, or Black women and men actually tend to have disease at a heavier weight. So those BMIs are 31, 29, 33. Those are all technically in the overweight or obesity category, but we're having to gain more weight before we really get sick. So we need to adjust the BMI to fit our patient population. And again, the BMI wasn't even created by a physician. It wasn't created for anyone of other ethnicities, Black, it needs to be tailored. So you can't just take it and say, okay, that's fine. It works for everyone. So next slide. I think that might be it.
That was
thank
it.
you for your attention, guys.
Thank you so much, Dr. Tiffany. And I know we went through that and she dropped a lot of knowledge. I want to just remind you, we went in detail in the men's section and in the women's section. So if you have more questions, especially with the BMI and how do we screen differently for Black men, Black women, then you can check out those previous webinars that we did. So moving along, we are at the 6:50 mark. And so we're going to keep chugging along at these slides. And then if y'all have questions, please put them in there. I saw there was one about, oh, can you tell the difference, discuss the difference between weight gain when it comes from fat versus muscle? Is it true muscle is heavier than fat? Can we address that question? And
I actually was typing something in.
Go ahead.
No, I'm just typing. You talk. I'm going to write it down.
Okay, great.
Yes, fat does weigh less than muscle. So I love Dr. Tiffany's example of looking at BMI and someone who is very muscle bound and they weigh more, making sure that we make that make sense. And so, yes, that is true. Muscle weighs more than fat. And we need to take that into account if we're looking at someone's total health. So thank you for that question. I couldn't see who asked it, but thank you for that question.
It was Nikita. And Nikita, also your question about being big bone and beautiful, I think Dr. Tiffany addressed it really well. So words matter. People aren't obese. Dr. L, if you want to just quickly touch on this, and then we'll get to the details about how people can, the relationship between mental health and then some lifestyle changes people can make.
Of course, yes, words do matter because one, we are all affected by the words. And that's why I'm such a component of using positive language, even with myself. And also when I was very conscious of that raising my son. So I knew that if I said some things that would hurt his feelings, that's not a way to kind of get your child to do what they need to do. But just because we're adults, we still have those feelings and we don't have the armor that we like to think we have, meaning that hard shell can be penetrated with simple words. And so not only the words that you are hearing from others towards you, but also the words you say to yourself. And I think Dr. Tiffany related to that as well. We must also have good self-positive language. So then that way we're not falling victim to other people having bias when we're talking about obesity as well as other issues or concerns in our life. So words do matter, and people are not obese, they have obesity. And it's very important that as clinicians, we start to say that, and then that way we stop having that accusatory language toward patients that have a problem that we need to help them solve. So yes, thank you, Dr. Sylvia, for allowing me to make that clear.
Thank you, Dr. L. And Janice, we see your question. I'll make sure we answer it. And then the effects of weight bias on body, mind, and spirit in society, Dr. Tiffany.
Okay, I will make it quick. We got less than 4 minutes. So this is just a brief, obesity and mental health affect a lot of people. 1 in 5 report that the pandemic had this significant impact on their mental health. We all lived through it. It's been very difficult for a lot of people, very isolating for a lot of people, and they had increased mental health issues, but then also weight gain. So they kind of went together. Next slide.
And I just want to say we have till 7:15 and we'll leave 15 minutes for questions. So don't worry, but we'll get it in. Yeah. Okay,
yeah, that's great. Okay, so I'll tell y'all a little more then. And then it's in terms of obesity and mental health being bidirectional, they actually have proven through research studies that having obesity increases your risk of depression, and being depressed can increase your risk of having obesity. And so it's not like you can say this caused that. They both are going in either way. Also, people who have had heart attacks, for instance, a lot of people don't know this, they are at a higher risk of having depression and having, a lot of suicidal thoughts that they hadn't had before. And so sometimes when someone has a heart attack, you immediately put them on an antidepressant to kind of help stop that from being an issue. But emotional eating, disordered eating can be a container for rage, sadness, depression, and grief. And so there are lots of reasons that people eat. We all know that even if you're not an emotional eater in society, you graduate, you go out to dinner, you are on a date, you go out to dinner, you're with your friends, that we use food for many reasons. And then trauma is so important in our society, especially in the Black community, where trauma is often not addressed. maybe not noticed, and the signs are confused. So people will say, oh, that kid acts so bad. Why is he acting like this? And I see them because I see children too. And I'm thinking, oh, this isn't a bad kid. This is a depressed child. This is a traumatized child who is acting out in ways that they're trying to get, attention or love or whatever. So quickly, adverse childhood experiences. These are all things that unfortunately are very common in our communities. They happen to a lot of people without even noticing it's an issue, and they lead to worse health down the line. So abuse, physical, mental, sexual abuse to the actual child or person, physical, emotional neglect, right? So not getting your needs met. And then household dysfunction. And this part sort of surprises people because they think, oh, that didn't matter. But living with someone with mental illness, having a family member become incarcerated or get arrested or something like that, watching your mother specifically be treated violently. So sure, aggression in the house is bad, but their mother specifically, then substance use, and then even your parents divorcing. All of those things can increase your risk of mental health disorders, and it can increase your risk of obesity, heart disease, et cetera. And so that all sounds very negative. So I remind people, if you have a child or you see someone in that situation, even having one safe person that they can turn to will help sort of decrease the outcomes from this trauma. And of course, therapy, I always recommend therapy as well. Next slide. Stress and mental health, do not try to read this. Look at the bottom, that's all I'm gonna say. I mean, it's just basically saying it's a very complicated interaction. And the more you increase your stress, you'll have increased cortisol. You probably all heard that commercial back in the day, late at night, increased stress equals cortisol equals belly fat, and so cortisol can cause you to store more fat, have more weight gain, and then of course you'll have worse health likely after that. So we need to control our stress, which is why I was grateful for that meditation in the beginning. A few key points on obesity that I always like to say, usually early in my presentation, is that obesity is not a bad word. We don't like to hear it. We don't want to see it written down, but the truth is it's a disease, and you can't get treatment for diseases that people don't acknowledge, right? So if I have allergies and I go to the doctor sneezing, eyes itching, nose running, and they're like, you're fine, then they're not going to give me allergy medicine because they have not said I have allergies. So we just have to be willing to hear it and then do something about it. It's not judging you, it's just about that disorder. So, and of course it comes from many reasons, not just eating less and, eating better or working out more. So bias impacts health. And you can see this diagram that was beautifully made by Dr. Sylvia. And spirit, mind, body, they all come together, and we need to use that to really find some optimal health. But bias can cause you to be less likely to seek medical care, to not trust your doctors. We have long histories of discrimination and real reasons not to trust doctors, but still you have to find a doctor that you can trust. So that's why when Dr. L said, if you need to switch doctors, please do so, because I've even had to switch doctors as a doctor because there are times I go and they don't even know I'm a physician and refuse to acknowledge it and won't answer my questions. And, my health is getting worse, and I'm thinking, I got to get out of here. So don't worry about offending people. You need to go and worry about yourself, because if you don't save yourself, you won't be here to care for your family. And then look, so also if you have bias or, you also will not follow through with the plan because you don't believe in your doctor and what they're telling you. Next slide. Obesity and weight, and they impact more than one another. It also can impact your long-term health and wellness. Next slide. All right, we talked about this a bit, but just to be clear, I'm sure you had it in all the other presentations as well. When we say obesity, we're not simply talking about what you look like when you pull on your clothes, whether or not you can do like that band that makes you have a waist. I'm not cool anymore, but the little waistband, and we're not talking about that. We're talking about your heart and your health and your body. And obesity, unfortunately, is linked to 236 diseases. And so that's a big deal. And it's something that we can actually stop on the forefront and have longer life in the end. There is hope though. So obesity is killing the world, but it's preventable. So we have to just say that. Next slide. All right. I will talk about this part briefly. So I said I do a lot of health policy work. I recently spoke at the White House, and I was speaking on the Hill to Congress people about why we really do need some improvement in the coverage for obesity medicines. People don't want to take these medicines, I get it, but those medicines do work. And if you don't have access to good healthcare or medications, you really are at a disadvantage. And so it's important that you have coverage for obesity medications, have coverage for bariatric procedures like surgery, or, they have different non-surgical procedures that can be done that help you lose weight. And if we don't have the coverage, we can't get it. And our people, Black people, minorities, underserved, are suffering from things that really can be fixed, and they are curable. So we have to advocate for that. Next slide. All right, so we actually have some new medications that are coming out that are getting almost as good as surgery. So that's great, but you can't afford them, most people, because they're very, very expensive. And so this is just showing what the difference ways you can improve your weight. So lifestyle modifications. I am board certified in lifestyle medicine. I always will tell you, choose healthy foods, try to eat fruits and vegetables, sleep, decrease your stress, don't drink or drink and do fewer substances, those things are all important, but that's going to equal about 2 to 5% of weight loss, right? And so start with that, sure, but there are other ways that you can lose more weight. And so that's just what this graph is showing. Next slide. All right, this is, a complicated slide where you see different insurances. You have Medicaid, you have Medicare, Blue Cross Blue Shield. But basically what you see if you really zoom in and try to read these is that very few anti-obesity medications are covered. All these X's. Now, luckily, some of them are really cheap, like phentermine, you can maybe get just paying cash for a decent price. And there are ways to work around, but you've got to be willing to get to a doctor who will work around. And if you're waiting on your insurance, then you're going to have a hard time really finding coverage. So that's why we need lots of advocacy, lots of policy workers, and we need our people to write to our Congress people and tell them we care about this and we really do need something to change. So that's what this is going to indicate. Next slide. All right, we got a quick quiz. Medications that treat obesity are only for weight loss, cheating. You should be able to lose your weight without medications, only for short-term use, so less than 3 months, or none of the above.
Well, we got a little bit of a debate in the chat. We see some none, so D, all of above, and C, short-term use. So can you talk to this, Dr. Tiffani?
Sure. All right. So I would say, just to answer that question, you can be on medications for longer than 3 months, and you probably would need to be because because obesity is so complicated. The hormonal causes that are there, the genetic changes that have happened, your environment, those things likely have not changed in those 3 months. So if you get on that medicine and then immediately get off, you're going to gain the weight back, unfortunately. So it's not just for weight loss. The medications can help with depression and migraines and diabetes sometimes, and lots of other things. It's not cheating. We'll talk about why next. And then we do try to keep you on the medicine if it works for you. So the reason it's not cheating, in our opinion, right, is because someone with obesity already has a changed hormonal background, right? They already are at a disadvantage. They can't just get up and go for a run and work out 10 hours a day like the Biggest Loser and then all of a sudden lose all this weight. And so Dr. Sylvia made this wonderful graph here where you see there's a starting line in the middle, and then you have people who have obesity behind the starting line. So the best that those medications are doing most of the time is getting you to the starting line so you can actually do the lifestyle changes that we saw really are very good. They're very healthy, but they don't make you lose a lot of weight necessarily. And so the medicines kind of just make it a fair race if we were all competing, which we're not. But, it just makes it so that you can start behind and then still get to the point where I can still eat healthy and I can exercise and I can sleep well, and I might actually be able to maintain a healthy weight versus if I did all those same things and did not have the medication. Side note really quickly, I have lots of patients who they eat less than me. They exercise more sometimes, they are sleeping and they cannot lose weight. And what do? They blame themselves, they feel badly, they get down, they get depressed. And the truth is, it's not them, it's just the disease of obesity. So that's really important to remember. Next slide. So racial disparities in obesity treatment. We unfortunately have lower bariatric surgery referral rates because what did I tell you guys? If you're not diagnosed with it, then you can't get treatment for it. And I mean, nobody wants to see it in their chart, but sometimes we have to just get it there so we can get what we need. And so people aren't even referred. Then there are times where there are higher complications, and there's no significant difference in remission of diabetes with the insulin dependence, without insulin dependence, or hyperlipidemia. So there are people who are not doing well after surgery. And I would think that's likely because of support, understanding, proper counseling and preparation before you have surgery. Surgery works, but it doesn't make it so that you can just, do whatever you want and eat however. So you still have to have good follow-up care. Next slide. Okay, so ways that you can address your weight bias. We all have personal biases that I mentioned. It's important to realize the impact of systemic bias, meaning if I go outside and want to go for a run, but I'm in a scary neighborhood, or, there's no sidewalks, it's so hot, there are no trees, there's no way for me to safely go to the park, that's going to make it really difficult. And it's just something we have to stop blaming outwardly and sort of increase our awareness on why someone is in the situation that they're in. And then we can take action by writing our congressmen if they'll listen. So anyway, those are important things to do. Thank you for your attention.
Thank you, Dr. Tiffany, for those amazing points. Now, I think how we can do this next part is how can you personally address weight discrimination? I know you have some tips and Dr. L has some. Dr. L was actually going to tell us what was going on with that little boy in the beginning, and then just give us some tips. And then a question that was posed in the Q&A was, how would you suggest normalizing the conversations around obesity and health in general within our sisterhood circle? So maybe Dr. L, why don't you go ahead and just touch on, remind us of what happened with your case, and then some things that people can do. And then I'll let Dr. Tiffany speak, and then I know Jermaine's going to tell us a few things about what Black Health has going on with the policy space.
Thank you, Dr. Sylvia. So I was able to convince the mom of our 3-year-old wonderful child that he needed further evaluation. And just with me explaining all of the different facets of what I saw in my exam, she was willing to let me do what I need to do for him. And in this case, at 3 years old in Texas, a well-child check also involves checking their blood for lead level. So he was going to need a blood draw anyway. So what I also added on there was a full metabolic evaluation, like the panels that of checking for diabetes, as well as thyroid and a few other different diseases. And so with that, on the follow-up visit, again, we scheduled a follow-up visit about a week apart so that mom knew, one, I wasn't just pushing her out the door, but she felt like she had some support in this situation. And with that, I went over all of the lab work, and lo and behold, this child actually had hypothyroidism. 3 years old, hypothyroidism. And with that, that was one of the reasons that he was gaining weight much faster than a child who did simply just eat an entire family-sized bag of Cheetos, much faster than a child who ate pretty much half a cake whenever his grandmother allowed him to. There was something else going on. And I was so grateful that mom opened up her mindset to say, okay, help. And then when we found this out, I was able to get him into the specialist endocrinologist at the Children's Hospital near us. And it was amazing to me because they saw him very quickly. When I explained everything to them, they were like, oh, we need to see him pretty soon. And as soon as that child left the endocrinologist visit, within 2 days, the endocrinologist actually called me and said, thank you, Dr. Flowers, for looking past this child just being overweight, or in this case, obese. If he had not been seen and treated immediately, he most likely would have ended up in a coma in less than a week. Now, for me, that's significant because one, being a mom, this is a mom who could have lost her child simply because he had a medical problem that caused him to have obesity. And so with that, that's one of the things that we have to open up our mindset, that obesity is caused by multi-factors. And with that, we have to also be our own advocates at times. We know when there's things going wrong or don't feel right, whether you're the mom and we're talking about your body, or in our case, we're talking about a child, you kind of have a sense something's not right. And mom had that sense. And with her opening up to me, she shared that I knew something wasn't right because he's not even chubby like our other cousins. He was way bigger. So with that, we got to the bottom of the problem. And now he, being treated appropriately, became a child who grew up to have a healthy weight and very vivacious. And so I'm very happy that I got to share that story, because we talk about obesity, but a lot of us think of it only in adults, but we can't forget about our kids. They're just not miniature adults. They are children still going through growth phases, still going and learning and all of these things. And we have to understand when there is a problem in that normal growth cycle, we need to pay attention to it. So thank you, Dr. Sylvia, for letting me give this case so that we can all have a perspective that obesity does not just affect adults. This is not an adult problem. This is a problem that we need to treat in children, and not just say, okay, they're a little chubby, I'll just buy them the husky size instead of the regular size. But let's actually start looking past that, and then also taking steps. So some of the things that we can do when we are wanting to be an advocate for ourselves, I tell people all the time, if you own a Ferrari or a Lamborghini, whatever your favorite luxury car is, you will most certainly put premium gas in that car. Am I right? I'll shake everybody's head for you. So are you not more valuable than a car? If you believe that you are, then you won't continue to eat food that's not at the best that you can afford. And that's how I approach a lot of the patients that I'm able to help, is I tell them to commit to buying the highest quality of food that they can afford. That way, I'm not giving them any reasons to say, oh, she said I can only eat one thing. I'm like, no, we talk about a variety of foods. We talk about the nutritional deficits that a lot of us have if you eat the common American diet. And then I also am encouraging, saying, you know, even if you just lost 10 pounds, you actually will change your trajectory for heart disease and all the other complications that Dr. Tiffani mentioned that are related to obesity. So even 10 pounds can make a huge difference. And I think by encouraging people, by giving them actionable steps and small goals to work toward, those small goals, when they achieve them, they have a great impact. And so that's one of the things that I do. I'm a cheerleader for so many people. And I know Marie asked a question about when people are over 60 and they've gained weight. You know, that's something that I actually do now. And those are hormonal changes. And I appreciate Dr. Sylvia for mentioning that, because that's a whole nother gamut of reasons why people can have obesity as well. So with that, it's a multifactorial issue. It's not just about adults, and we can take control by doing what we can, but asking for help and being open. But like Dr. Tiffani says, we first have to be willing to acknowledge and call it what it is, so that way we can get the appropriate help that everyone needs, whether it's medication, surgeries, or whatever is the best option for you. But it does start with us having an honest conversation. So thank you, Dr. Sylvia.
Thank you. And that was a great segue into Dr. Tiffani, who had this great slide, which let thy food be thy medicine and thy medicine be thy food. And then just Dr. Tiffani, if you wanted to quickly say, which really Dr.
really
Al covered it too.
Yeah, that's awesome. So we have to change how we look at food. I saw someone wrote that. And what can we do right now? So these are not necessarily easy, but they do work for us. Change our priorities. We want to focus on wellness, not weight, right? We want to be well. You may not lose a lot of weight on the scale, but that's okay, because your health might get better. You'll be healthier, not out of breath, you know, able to exercise and dance and have fun. You can change the policies, so you can advocate. You can talk to your boss if you work at a place and ask them, can we go on walking breaks for lunch instead of, you know, people used to get 15-minute smoke breaks. Can I get a 15-minute walk break? You know, or whatever. There are ways that you can change policy in that way. And then also change the lifestyle. And for that, I say for our people, we are big on fun, fitness, faith. My personal philosophy is always choose joy, right? So anything you have to do, there's a way to do it in an enjoyable way. And there's also a way to do it in a healthy way, right? So find something you can do, dance, put on some music, clean, garden, whatever it is, we can do that. So commit to putting ourselves and our health first at the top of our list. It is difficult when you're a parent or you're busy or you're working, whatever, but just keep moving yourself back to the top so you can at least get something done for yourself. Choose healthy foods whenever you can. I love that. The best quality foods you can. Even if you're at fast food, they have salads, they have grilled foods. Try, you just, make a plan before you go. Reduce your stress. And if you need help, ask for help. There's no shame in that. You can't get better if you don't ask for help. Nobody has to know you're getting help, because at these days, I have a telemedicine practice, the Healthy Way MD, and you don't have to necessarily even tell somebody that you went to a doctor. Do what you have to do to get yourself healthy. And it's just very important. I want us all to live long, healthy lives so we can see our grandkids. So thank you.
Thank you. Yes, those were such great points. So we're going to shift, and Black Health is going to tell us what they're doing on a systemic level. Just wanted to highlight this slide with just the quadruple effect of obesity and bias in the LGBTQ plus community. We shared this slide throughout the different presentations, but lesbians are more likely to have obesity, even though in the Black women will be less likely in the lesbian population, but still also gay men are less likely to have it, but have a higher rates of eating disorders. So we really need to be screening, but again, talking about that intersection between weight and mental health as well. And then the bias is amplified. So we talked about that they have even higher rates of weight bias, workplace discrimination, racism, and sexuality bias as well, and decreased access to healthcare, as well as decreased seeking out healthcare because of the experiences of discrimination. So just something to make sure that when we're having this conversation, that it weighs differently on all of us, and that depending on the type of biases that are being carried. So just coming from it, making sure, again, as all the presenters have said, that you feel comfortable with your clinician, that you can have open conversations, that you're not feeling judged or stigmatized. And also for us as clinicians, or us as people, being aware of those biases that we have, so that we're treating everyone fairly and kindly as well, and equally and effectively. So with that being said, I see that Mr. Jermaine Meadows has come up, and we'll yield the mic to him to just talk about what Black Health is doing to address weight discrimination and increase accessibility for obesity care in the Black population.
Thank you. Good evening, everyone. Thank you for having me to discuss how's Black Health treating weight discrimination. So policy changes are needed in order to change the system, right? Treating obesity in the Black community is one of the priorities of Black Health. Policy changes are needed in order to change the system. So currently, we're planning to host a legislative breakfast to highlight Black Health policy priorities and how we can collaborate with elected officials to push the agenda forward. We must remain politically engaged. Currently, we are members of the Health Equity Coalition for Chronic Disease, which is a coalition established to eliminate barriers to quality healthcare, particularly concerning chronic disease in communities of color and marginalized communities. Along with the coalition, we have hosted listening sessions to contribute to the White House Conference on Hunger, Nutrition, and Health. So we are pushing for Congress to pass the Treat and Reduce Obesity Act. Obesity must not simply be seen as a cosmetic concern. The reality is it's a chronic disease. The continuum of care should include access to anti-obesity medication, lifestyle changes for a healthier diet, more exercise, surgery, and counseling from qualified obesity practitioners. Obesity can be treated to improve health outcomes. However, many patients lack access to treatment. Here at Black Health, we have sent letters to Congress and the U.S. Health and Human Services Secretary, encouraging them to take swift action to stem the tide of obesity, which disproportionately impact communities of color. We are addressing the problem by urging Congress, CMS to clarify that FDA-approved anti-obesity medications are not agents for weight loss. They are treating a chronic disease, which means it should be covered by Medicare Part D plan. This can save Medicare and Medicaid $66 billion over the next 10 years. Obesity is a chronic disease that requires a comprehensive approach for both prevention and treatment. That being said, I invite everyone to visit our website for more information, and I encourage you to learn more about the Obesity Through Black Health Learning Academy taught by Dr. Sylvia.
Thank you so much, Jermaine, for that great overview. And one of the things that we're working on that will be coming soon to make it easy for you to write a letter to your legislators is that we're going to have a letter writing campaign. So all of you should have given an email. So we're going to be able to send that out to you, and they're working on the infrastructure. So that'll be super easy for it. You just like plug and play and can send that. But, you know, we've shared with you today, I think one of the big stigma in our community is I got to do this all by myself. It's got to be hard. You know, in the words of the great Kendrick Lamar, all my life I had to fight, you know, so we think that it has to be a fight and struggle, but we need these tools to help us, and increasing access to it is really helpful. And so that's why I'm really excited that Black Health is doing, and other organizations that are working and lobbying to get this to pass. Y'all still laughing about me and Kendrick Lamar. Y'all know I love it. I guess he really took it from Color Purple, but I digress. Okay, so here we go, y'all. So thank you so much for rocking with us and hanging with us for this hour plus. You have put in some great questions. I hope we addressed all your questions. If you don't feel your question was addressed, please let us know. But by now, you know that words do matter. It's not just about calling people obese, that there's a difference between fat phobia and weight bias. And you could even write what you learned in the chat. That actually probably would be the better way to go, because we want to make sure that this was effective and that you got the information that you needed from it. But then just how all the different forms of bias intersect, the intersection of how it weighs on the body, mind, and spirit, and then what you can do to empower yourself. Someone asked, I believe it was Nikita, about like normalizing the conversations in our circles. I take the Dr. Tiffany approach as well. You know, there's been so much stigma on the Black body. There's a book we both all like by Dr. Strings called Fear in the Black Body. I don't agree with her medical conclusions, but I think that she did a beautiful job explaining the sociological impact of racism on the Black body. And I think that as such, we have kind of like said, you know, I love my body, and we're taking pride and ownership of it. And that is a very wonderful thing. And we should do that, but not at the detriment of our health. So in our sister circles, we have to bring it back to that. This is about your health. This is because I love you and I want you to be. And I wouldn't even talk about the weight. Like, girl, you look good at whatever you wear, whatever you put on, but how are you really feeling? Like maybe the fact that you can't sleep, it has to do with the extra weight that you're carrying. And I take it a step further, because weight is always a symptom. So it's not the physical per se, but it also could be, like we talked about, the stress, the trauma that's unaddressed, all of these things. And so hopefully we've left you with a lot of great thoughts here. And I know Dr. Tiffany put this, that most importantly, we must take care of ourselves first, right? The COVID-19 pandemic was a wake-up call. I think even for us as clinicians, that I think all three of us launched out of traditional medicine and started our own practice during the COVID-19 pandemic, because we were like, look, we got to get this like new information to the people in a better way. And the confines of traditional medicine is not going to let us do that. And so lifestyle medicine can be incorporated to all aspects of your life. But if you need medicine, you need help, we are here to help you in all ways. So thank you so much, Black Health, for the space, for the platform, for the investment in our community, the time, the resources. I just want to say thank you for the honor of being able to work with you all for this past year, really, but definitely during this 4-part series. And really, to everyone, please share this information out. You know, it's crazy. A celebrity will get 1 million views for just changing their hair color, but this information that can change people's lives, that can save lives, it's not even getting any clicks. And I want to say we're interested and we're cute and we can give this information. It's entertaining, it's not boring. So share this information out, especially talk about it in your sister circles. Say, hey, let's have a watch party. let's have a watch party. Let's talk about this. What y'all think about this? And these are the ways to have these conversations so that change can happen. It won't happen overnight. I used to be an idealist. I was like, oh my gosh, I'm going to revolutionize the world, but it takes time, and that's okay. We just keep putting in the seeds and planting the seeds. Now, with that said, I yield the mic to Ms. Tashi. Ms. Tashi doesn't play with time, so I already know how she's feeling right now. Ms. Tashi, thank you very much. And thank you, Dr. L and Dr. Tiffany and Jermaine and everyone for being here today.
Thank you all.
Thank you.
Do your survey.
Yes, please. Thank you. And thank you so much, Dr. Sylvia. Please, everyone, before you leave, I know it's dinner time. I know that you have little ones and husbands and everything, or wives, or whomever to get to, but please complete this survey. And also, I want to run this poll really quickly to see what we've learned, okay? So I'm watching it now. Please let me know if you can access the poll, if you can answer on the poll. If not, please answer in the chat. So the first question is, obesity is defined as the abnormal or excessive fat accumulation that presents a risk to health. Is that true or is it false? Number two, obesity is the least common chronic illness in the United States. True or false? Number three, how would you define the quality of efforts to support healthy eating and physical activity in your community? Very good, good, acceptable, or poor? Please make your selections. And as I said, if you cannot use the poll, I invite you to enter your answers in the chat. Okay. Come on. I'll give you all another moment. And again, please do the survey. They usually leave it up for a little bit to give you all some time to complete it. I know it's pretty lengthy, but we do appreciate the feedback, and it helps us for programs like this. We want to know how you feel. Was it useful? Did we waste your time? Did you learn from it? Did you enjoy it? Do you want more programs like this? Did you think that Dr. Flowers had fly hair? Like what? We want to know all of that. We want to know what type of vitamins Dr. Tiffany takes to have all of these degrees and those beautiful children. We want to know how if Dr. Sylvia is fabulous like this all the time, and you want to know how you can be too. All of that we need to know. First, we need to know about these poll questions. All right. So let us see. All right. So 93% of you think that it's true that obesity is defined as the abnormal or excessive fat accumulation that presents as a health risk. 86% of you believe that it's false, that obesity is the least common chronic disease in the United States. And 29 of you believe that the quality of efforts to support healthy eating and physical activity in your community is good. 7% of you believe it's acceptable, and a whopping 64% of you believe that it's poor. So I'd like to invite our panelists to discuss these poll questions and results.
Yeah, can I say something really quick, and then I'll let them answer too. I just want to say, number one, the key thing in that, because I do get the pushback on this, is obesity is the abnormal or excessive fat accumulation. We are not saying fat is bad. We need fat. Fat is a vital organ in our bodies, especially for women. It protects our inner organs. It helps us regulate our hormones. It keeps our body temperature regulated. There are a lot of, it helps us absorb our food. There are a lot of important benefits of fat. And we know that not having enough fat is also harmful. Like people can have too little fat. So again, we're saying that it's the abnormal excess accumulation. And honestly, as we are starting to learn with how the BMI can be so off and everything, is that it may be a little bit different in every body and every person. And we went into deeper dive about this in the previous one. So in the first three lectures, this one was more talking about policy and the external, internal factors. But I encourage you, if you called it false, or if you have some more questions, watch those earlier ones, and then feel free to reach out. Feel free to go to the Black Health website, check out the book. Like, there's resources to it, because again, just to focus on it's the abnormal and excess. It's not, fat is not bad. That is not what we're saying. We need fat in our body. It's good for us. So I just want to highlight that point, and then just say, Tashi, I think this number 3 is really concerning. And I even without taking the survey, I vote we need another talk just on how can we make these lifestyle interventions when our community is suffering so much, when our community is set up to fail, honestly. And that's what a lot of our Black and brown people are facing, but there are things that we can do. And with that, I'll yield the mic.
I wanted to address question number 2. Obesity is the least common chronic disease in the United States. Well, with the case that I gave you guys, that's disproving that, because obesity affects adults, children, adolescents, elderly, the whole age range of people. And just because someone is obese doesn't mean that they all have diabetes or heart disease, but they will have some type of health risk complications down the line. So obesity can affect any age group. And so it is the most common, because not everyone has heart disease, not everyone has diabetes, or some of the other things that we normally call chronic disease, but it is something that everyone can have at any time. And it's very important for us to acknowledge that. So that's concerning to me that so many people say false, because the example that I gave you today, certainly with the Samoan and the African-American heritage, mom was also slightly overweight. That's why she didn't think much more of her son until he started showing some physical signs. So I do hope that you guys take away the point that obesity is the most common, actually, instead of the least common. Thank you.
Very good. Yes. And just to speak on the last one, as Dr. Sylvia just did, how would you define the quality of efforts to support healthy eating and physical activity in your community? I think that is a place where we clearly need some improvement. And I think that's an action point for us to address. I'm working on it in my community. I'm sure they are working on it in theirs. And we can spread our communities by doing virtual things. So, you can still find the access and the help that you need. But that is concerning. And I feel that we need to work on that one. So.
Very well said, Dr. Tiffany. Yep, and certainly here in Montgomery County, Maryland, where I am, that's one of the programs that we're working on piloting. I'm part of the Black Physicians Healthcare Network, and that's something that we're working on doing now, is how to combine and collate the services, because the services are out there, but if we don't talk to each other and put them together in a way that integrates and helps the person, or you don't know how to use the foods that are being given. I remember I did a talk recently, and I was sharing this beautiful chickpea recipe I made, right? I forget that it's been an 8-year journey for me. I eat a lot of foods now that I didn't eat when I was a little Southern girl in Atlanta, Georgia, growing up to West African parents, right? Growing up on fufu fried chicken and jello rice. Like I eat differently now. So someone said, then fortunately they felt comfortable, like, Dr. Sylvia, how does a chickpea taste? And I was like, ooh, I got to take it back and remember what it felt like to not be familiar with these foods. So thank you for bringing that up.
Yes.
All righty. Thank you all. And if you all don't have any other questions for our panelists or any other comments, Thank you for your time. Feel free to reach out to them. You see they have their social media available at the end of the slide. So please feel free to reach out to them. They're happy to talk, and they're happy for you to share your stories, your journey. So please don't be a stranger. Thank you for all of you, any of you who have been here from series 1, right? Well, part 1 rather. If you were here from part 1, please say so in the chat so we can shout you out really quickly. If you were here from part 1 and came back from part 2 and didn't mind part 3 and wanted to wrap up with us for part 4, please just say so in the chat so that we can thank you for your time. We definitely appreciate you for being here with us. And if there's nothing else, we'll see you for the conference, right? That Dr. Sylvia is pushing for us to
let Black Health know we need a conference.
We're gonna put this out here into the atmosphere.
Count
Tell
me in.
Ms. Fields.
We recognize that it's necessary. So thank you all. Have a great evening.
Tashi, did you see my question though? Do I count? Because I've been at all of them.
Oh, you were here? You and I, we were here. Yes, you always count. Yeah, always count. Okay. Thank you.
Thank you,
Thank you for coming back, Tammy. Thank you. And thank you all. Have a great night.
Thank you, Nikita.
Safe.
Thank you, Ms. Granville. Thank you, everyone, for being here. Thank you for your engagement and your questions. And yes, God bless you too, Elizabeth. Thank you for sharing. Yeah, but go back and listen. Schedule that watch party. Let us know. But thank you so much. Yeah. Thank you, Tashi. Thank you. Dr.
Thank you,
Tammy,
everyone.
Dr. M.
Have a great
everyone.
night.
Bye, Jermaine.
Have a good night.
night.